relevant for Huntington's disease. Because it's about neurocognitive decline. And as we know, complex attention, executive function, learning and memory, language, perceptual motor, or social cognition are big things that are impacted in HD. And then it's the same marked limitation. Oh, I forgot to remove the physical functioning. There's no physical functioning requirement for 12.02. It's just cognitive. And I will share a resource with you guys at the end where you can find more information about this. But gathering evidence is really important to a Social Security disability claim. And while legally Social Security has to request your medical records, they don't have to obtain them. Social Security has to deal with getting records from giant medical record departments. There's a lot of stuff that goes on. So even though they try and they follow up on multiple occasions, they don't always get what they need. You can provide it. So you need to look at medical evidence. And for this, you want to be open and honest with your doctors to make sure your medical records reflect the severity of your HD. If every time you go to a neurologist and you say that you're fine or you don't have new symptoms or you don't talk about things, your medical records aren't going to reflect your condition and you can very easily get denied because Social Security depends on medical records more than anything else. You also want to share your activities of daily living. So again, your ability to chores, go to the bathroom, cook, all those things. Again, do not play down your symptoms. Do not downplay your symptoms. Focus on what you cannot do and what has changed. Completing a disability application sucks. It sucks. It's hard, and you have to do it from the perspective of a bad day. You kind of have to go to, I call it the dark place. You have to really, you or your loved one really has to think about everything that's changed, what you can't do anymore. Because if you focus on only the positives, you're going to send the wrong message to Social Security. I've seen it happen time and time again, and I've seen families get denied time and time again because they send the wrong message. It's also important, if you have them, to share employment records and education records. Where do you need to gather evidence from? Your doctors, all of your doctors, not just your neurologist, your therapists, employers, and friends and family. And how do you gather evidence? You get your medical records, you get medical letters from your doctors, primarily your neurologist, or a psychiatrist if you see one, and then letters from friends and families and employers, and then your own personal experience. Do not downplay your own personal experience. Like I got to the point where I was asking my clients, like, do they have trouble tying their shoes? Do they have trouble buttoning buttons or using a zipper? Like, do you have to sit down now to put on your pants or your shoes or your socks? It may seem minor and irrelevant to Social Security. It's not. There's no such thing as giving them too much information. So what to include in the application? You need to say that you have adult onset Huntington's disease per listing 11.17 or 12.02, or throw out both. I don't care. Make the application as strong as possible. Then you want to include the symptoms you experience, the limitations caused by your symptoms, and again, do it all from the perspective of a bad day. HD is a compassionate allowance condition, but because their system is weird and they think they put Huntington's disease under A, they're alphabetically challenged. So the compassionate flag for HD gets missed a lot. In your application, specifically say, I have HD, which is a compassionate allowance condition. Please flag my claim per DI 23022.923. It's their internal code. You'll need to include information about your current marriage, your prior marriage, and children, if that's applicable, total earnings for the past 2 years, past 15 years of work history. That can be a little hard. So if you have a resume, or like if you can start gathering that information ahead of time, that really helps. All physical and mental conditions that you experience, not just HD, if you also have back pain, anxiety, depression, high blood pressure, all of that is relevant because Social Security has to look at the combination of your records. And then again, all of your doctors and specific examples of how HD impacts your life. And then lastly, how should I advocate for myself, especially with Social Security? I am doing a webinar on Tuesday that goes in a lot more detail about how to advocate yourself once you submit an application. So if you're interested, please join me for that on Tuesday at noon Eastern time. But you want to follow up with Social Security regularly. Social Security will not update you on the status of your claim. Your job, it is your job to confirm that Social Security has the information they need for your claim from you. You want to continue to get medical treatment, and you want to contact Social Security if you have any appointments while your claim is pending, or if you have any like emergency hospitalizations or ER visits, because Social Security is not going to know to collect that stuff, and that can be really helpful to your claim. Complete any and all forms that Social Security sends you. Pay attention to deadlines, complete forms in a timely manner. provide as much detail as possible, call Social Security if you have questions, or call me, and attend consultative exams, aka Social Security doctor's appointments, and it's always in your best interest to go. And if you want more resources or information, it can be found at hdsa.org/disability. I'm just going to go there really fast. But there's a lot of information about Social Security, resource guides. So resource guides, I have a lot of different resources for families, general information for you guys to click on, checklists. There's a lot of good stuff here. And then disability chats. This is where you can register for current and upcoming disability chats. You can also go to past disability chats, and I have a lot of good past disability chats. It's definitely an excellent resource. And just here's my contact information. You are always welcome to contact me. I am here for families. That is why I have the job that I have. Thank you, guys.
Thank you so very much, Allison, for all the time you spend teaching us and all of our patients and caregivers. At this point, guys, we're going to transition to Jennifer Simpson, Assistant Director of Youth and Community Services. She's going to talk about advocacy. A very good friend of mine who works very hard for the HD community. Thank you, Jennifer.
Thank you so much, Lisa. And thank you, Allison, for that incredible presentation. There's so much information there, I know. So I'm sure you guys are all, your minds are spinning with, okay, what do I do? What is the next thing I do? So I'm here to kind of take what Allison talked about, especially when she's talking about, how do you advocate for yourself, and blow that up a bit and sort of give you some other ideas about what advocacy can look like and how you can advocate effectively. So when you think about advocacy for me, I really look at it, I'm a social worker by training, so advocacy is sort of in a little bit in my blood, but I think of it in my current role at HDSA, I think of it about how can you talk to people in power. So people in power, meaning your members of Congress, your state legislators. The issue about Tennessee not expanding Medicaid, that's your state legislators, that's your governor, that's your state legislature. Those are the folks who are controlling that. So all levels of government, whether it's federal, state, local, are important when we think about advocating and how we can work with those groups, those entities, to make the lives of not only you and your family, but people across the country better. So let's get rolling. Okay, so when we advocate, one of the biggest things that we can do is we build relationships. It's so unbelievably important that we work as a community to build relationships with people who are in power, because that's going to be important for us long-term, whether we're advocating for something today. If we're not building relationships with our members of Congress, when we advocate for something in a year, 2 years, 5 years, our job's going to be so much harder, because what will happen inevitably is there are thousands and thousands and thousands and thousands and thousands of groups like HDSA, who bigger than HDSA, who are going to their members of Congress and regularly and saying, hey, here we are, here are our issues, here's our community, here are the things we're interested in, this is what we need. And what we don't want to happen is when we go in and say, hey, it's us, we're families impacted by Huntington's disease, but we don't want our members of Congress to say is, who are you guys again? What is HD? What are you doing? That's bad news bears for us and for our community. So building relationships is so unbelievably key. Yada, 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 yada. Okay, when we think about Huntington's disease, right? Think about what parts of your life are affected by Huntington's disease. Just sort of take a second with yourself to think what parts of your life are impacted by HD. The answer tends to be everything, right? It's your work, it's your home, your finances, your kids, your family, everything is somehow impacted by Huntington's disease. And as a result, it means that it's really important for us to be advocating and for us to be looking at ways that we can improve our lives and the lives of others impacted by Huntington's disease, because it's touching every part of our lives. And there's a lot of opportunities for us to advocate. So why do we do it? Why is this important to us? Why do I come on and talk about advocacy and talk about the importance of this when you just had a presentation about the Social Security disability process, and probably are thinking, oh my God, that's going to be difficult. And I'm here to say, well, guess what? There's more. But why do I do that? I do that because it's how we make how big things change, right? When we are advocating, we're looking at changing things that are going to impact people, not just ourselves, but across the country. We advocate to make big changes. And when we talk about that, we advocate for things like enacting legislation. We advocate for changing regulations. We advocate for building new programs that are inclusive for HD families. We advocate for expanded funding for research and for programs that are going to be helpful for folks impacted by Huntington's disease. It's, advocacy is how we make big changes. And that being said, it's not something that you can do on your own, right? It's not something that me alone or Allison alone or Lisa alone can do. It takes a village to make big changes. I think sometimes it's also easy for us to look at government and say, how are we going to do anything, man? Sometimes it's tough for those guys to do anything. How are we going to get something done? And the point here is that there's always opportunities, but it takes a village, right? There's always opportunities for us to get things done. There's always opportunities for change, but we can't do it alone. So successful advocacy, and I think you can see this from either the government perspective or equally from the perspective of, working with your neurologists, working with your disability applications, right? Successful advocacy takes not just us, but it takes our family, it takes our friends, it takes our communities, it takes our care teams, it takes our village that we have to be a successful advocate and to successfully advocate. Right. Now, think about when I talk about government, that's sort of like the macro term is like the biggest version of that. But think about even little ways in which you've advocated in your life, and how bringing in a village has made that easier for you and has increased your opportunities for success. Right. Whether it's, think about it, even networking to get a job, right? When you bring in those people around you, bring in your friends, or you tap into networks, you tap into, other people in your life, it can make that easier. That's a form of advocacy. Now blow that up to think about the government. Oh my goodness, yes, of course, it's going to take us. It's going to take our friends. It's going to take all of our, our family members. It's going to take our care teams. It's going to take everybody. So like Allison mentioned, there are a couple things that we're advocating for right now that would make a big change. And one of them is the Huntington's Disease Parody Act. So I hope for folks in the room, this is not the first time you're hearing about this bill. It's something that I've been working on in my whole time that I've been at HDSA, so that's almost 7 years. And even 5 years before I came along, this is something that we've been working on. And part of the reason is, things at the federal level can move fairly slowly. It's not a quick process. But the other piece is that, we've been building the village. Part of what we've been trying to do over this time is build those relationships, build our allies, build all the folks to get involved more and more and more, and keep being involved. Keep being those folks who are reaching out to Senator Blackburn, who are reaching out to, your representatives in Tennessee to talk about Huntington's disease, to talk about this legislation. The HD Parody Act is something that is a fairly simple, small bill. It's bipartisan, which in the current climate can feel like a unicorn, but it's a really common sense little piece of legislation. And one of the things that's been constant about the HD Parody Act over all those 12 years is that it's asked to waive that 2-year Medicare waiting period for folks on SSDI as a result of their HD. So what that would mean is, instead of, like Allison mentioned, when you get your benefit, you get approved for disability and your payments start. Right now what happens is you have to wait until you get your 25th payment, or sort of 24 months to be eligible for Medicare. And is Medicare perfect? No, Medicare is not perfect. There are a lot of things to do and a lot of other pieces to advocate for, but it's something, and it's helpful. It's really, really helpful when folks can access it, because it means you've got access to the more robust of the two social or public insurance programs. Medicare is sort of inarguably much more robust than Medicaid. Medicare tends to pay more for services to doctors, tends to be accepted more places, tends to have more access to other ancillary services like psychiatry, physical therapy, occupational therapy. Those are all really important. And that's why we want it to be accessible for our families as soon as they're deemed disabled. As soon as they are able to access Social Security disability insurance, we need our families to have health care. It's a big, it's something that, because we're a small community, because this is also a very specific bill, it takes all of us coming together and saying, hey, this is really important. I care about this. I need this to pass either, and it might not be just for me. It might be, I might be at a point where I'm already Medicare eligible, or I'm lucky I had a spouse who I could jump on their insurance and we could afford it when I stopped working. But I don't know about my cousin. What about my cousin? What about my son? What about my brother? These are all the things that when we advocate, and when we advocate for the HD Parody Act in particular, right, we're looking to make big changes for folks across the community and for folks who are most vulnerable, right? The HD folks who don't have that spouse where they can jump on the insurance, who don't have the resources to be able to try and cover COBRA payments, who don't have the ability to pay out of pocket for private insurance. That's why we do this. That's why we push year after year. And we're in a position right now, actually, where we really need our community to come through. We need everybody in our community and beyond just reach out to their members of Congress and say, hey, this is important. I know you've got a lot of stuff going on, sure, of course, and we still need this passed. We need to pass this bill. And there are a lot of ways that you can do this. The easiest is to go to hdsa.org/takeaction, right? It's an easy online way to send a message to your members of Congress, and it will automatically figure out who they are when you put your information in. It'll also automatically figure out whether they are co-sponsors of the bill. And if they are, it'll send a thank you note. If they're not, it'll send a note to say, hey, we need you, right? We need you. We need your help. We need you as a co-sponsor of this legislation. Senator Blackburn's actually a really good example where she's been a co-sponsor previously, especially when she was in the House. But now that she's in the Senate, she needs a little bit more of a push, right? She needs to hear from folks in Tennessee. She needs to hear from you guys to say, hey, this is important to us. We're your constituents. We're folks who are suffering. And the only thing that we can do to fix that is government action. Because that's the other thing. For expanding access to waiving that 2-year waiting period, it can only be done through legislation and through government action. Otherwise, we would have found another way to do it. But this is the way, right? There are a lot of roadblocks that exist. And I had an advocate recently where we were on a meeting, and she talked about, having Huntington's disease in your life, this like sort of being at the bottom, you suddenly are faced with a mountain range in front of you and hills that you have to climb. And those hills have obstacles on them that you have to, maneuver around and figure out and try and get over. And there are some obstacles that we can deal with as in our own lives, and we can move and we can make better, or we can get out of the way. And there are some that we cannot, and this is one obstacle that only the government can remove. And that's what we're asking of them. The other thing is, think about the people in your lives who might have political connections, right? It could be the folks in your church group or your faith group. It could be the folks in your, if you're a Vols fan and you have a group that gets together to watch basketball every, during the season, talk to those folks. You never know who's going to have, who because of their work or because of their family have connections to members of Congress and the political world. Talk to them about this issue. Talk to them about, hey, this is something that I'm really working hard on and we're trying to get done, but we need help. We need help from not just within the community, but from outside of it to get this done. Bring it up. The worst thing that can ever happen is someone says, I don't really have a lot of connections, but, is there something else I can do? Can I help some other way? And you can send them to HDSA.org/takeaction to say, hey, yeah, go ahead, send a message, send a note. That would be really helpful. That's the best way for us to keep moving this ball forward and to get it over the finish line. We've been working really hard this Congress to get ourselves to a point where we are right now, where we've had really good conversations with leadership. We've had really good discussions with Speaker Pelosi, with Leader Schumer, who's now a co-sponsor of the HD Parody Act, with our lead sponsors in Senator Cassidy from Louisiana, Senator Gillibrand from New York, Representative Kinzinger from Illinois, and Representative Pascrell from New Jersey, to say, okay, here's what we need you guys to do. Here's where we're at. Here's our strategy. And we're at a point where, with pushes from our community, with pushes from what we call grassroots, we can get this done. I truly, truly believe that. I know we can do it. And we can't do it without engagement. We can't do it without the engagement of our community and our friends and our allies. So that's one piece of what we're advocating for right now. The other is we're really involved in coalitions around, Build Back Better, which has a lot of provisions in it that could be really, really helpful to HD families. Paid family and medical leave being a huge one, because it would be inclusive of caregiving, right? If you need to take paid time off for caregiving, a lot of folks, right now, in a lot of situations, you might be in a job where that's not an option. If you tried to take time off, they might come back and say, well, we don't need you anymore then. We're going to replace you, which happens. But if there's a provision for paid time off, it means that if your HD loved one is really struggling or is going through a crisis, you can take paid time to be their caregiver. You don't have to worry about where's the money going to come from? Are we going to be able to keep our house? How am I going to split between going to work and worrying about my loved one who might be at home or who I might be trying to care for? Who's got really high care needs right now, or who's having, real behavioral and psychiatric issues, or who's a real fall risk or has been in the hospital. That could help HD families in a big way. Again, taking one of those obstacles off the mountain. The other is Medicare drug pricing reform. That's part of the Build Back Better provisions that we've been part of coalitions to say, hey, this could really help our community. We want to make sure that for drugs that folks are accessing right now to help manage their HD symptoms, that they're actually accessible, that they're not going to be prohibitively expensive. And we know that that's a problem. So that's a big piece of it. Same thing with, again, Medicare Part D reform and drug price capping to say, hey, and out-of-pocket cost capping to say, there's going to be a maximum that you will pay for your copays for your drugs on Medicare Part D. That would be really helpful. That would be great. There's also a big piece in it for long-term care and skilled nursing facility investments, investments in making it in staff at long-term care facilities and SNFs to reduce turnover. Because one of the hard things that we know for our families is that you might place your loved one, and within 6 months, they've got a whole new care team because they've all turned over. And then you have to go and educate them again and teach them about your loved one. And that's really exhausting. And it's also hard for that person with HD who probably is really craving stability, and stability is really helpful for them as they're in this new environment. So that's a big piece. We also are advocating for a bill called the Credit for Caring Act. So Credit for Caring is a bill that would provide tax credit for caregivers every year. So basically you get a credit on your taxes as a caregiver. Again, it's something that would be helpful. Is it going to solve all the problems of the world? No. But is it going to be something that could be useful for our community? Absolutely. Again, taking some of those obstacles off the mountain. So how do we do this? How do we do any of this? One piece is we have to build those relationships. I know I talked at the very beginning about the importance of building relationships. So if you've never talked with your member of Congress, boy, it's a good time to start. They're there to work for you. You are their employer in many ways, actually in every way, because you vote. If you vote for them or you don't vote for them, they still work for you. Doesn't matter. If I'm in Tennessee, then Senator Blackburn works for me. I need to make sure that she knows what my priorities are, what my community's priorities are, what's going on, what she needs to do to help. That's her job. So we need to make sure that we're building those relationships with our members of Congress in the Senate and in the House. The other thing that's great right now is because of, obviously because of the ongoing coronavirus issues and social distancing and yada, yada, yada. One of the things that a lot of offices have been doing is saying, we're going to hold off on in-person meetings, but we'll take meetings over Zoom. So it means that advocating has become even easier in a lot of ways, because you could hop on a Zoom call, you can be, in your living room, you can be having your morning cup of coffee and meet with your member of Congress's office. You don't have to go anywhere. As long as you've got access to, a phone or a computer with Zoom, you can advocate. And it's been really nice. We had a fly-in a couple of weeks ago, and folks were able to participate because they didn't have to go anywhere. They didn't have to worry about leaving their loved one. They didn't have to worry about taking time off work. They didn't have to worry about, where am I gonna, managing bookings to get into Washington, D.C. and traveling, and what am I gonna do about, caring for my loved one while I'm gone? You didn't have to worry about any of that. Just had to jump on your computer. That was it. So the other thing I want to kind of leave you with is when we think about advocacy, it's not a sprint, it's a marathon. And what that means is we need to continually be engaging. You know, you reach out to your member of Congress once, that's great. If we never reach out to them again, they're going to forget, right? There are, again, thousands upon thousands of groups who are pinging them and saying, hey, we have issues, we need help, we need help. If we reach out once, we go right to the bottom of the pile because we're not keeping ourselves top of mind for our members of Congress. Our motto is, you know, the squeaky wheel gets the grease. So our job is to get squeaky. We need to squeak all over the place. We need to make sure that we are letting people know consistently that we are here, that these are the issues that we care about, that these are the things that our members of Congress need to do for us. And the last thing I want to leave you with is that without you, without folks in the community, without our friends, our families, our communities, our allies, forming relationships, getting to know our members of Congress, taking meetings, talking to people in power, our needs aren't going to be met by those people in power. So this is our opportunity, right? We get to do this work so that we can make big changes, not just for ourselves, but for our communities at large. It's also a great way to feel empowered. You know, I had an advocate who reached out to me after some of the meetings, after her member of Congress signed on to the HD Parody Act as a co-sponsor, and she said, you know, I've done political stuff before, but I never knew that I could have a voice. I never knew that I could get my member of Congress to pay attention to me, to pay attention to issues that I care about. You know, it made me feel like I have purpose, and it can feel amazing to be in that position to say, hey, I have done something tangible. Look at me, look at what I have done. And I know that, you know, the theme for today is, you know, living with purpose and finding vitality, and, you know, having this a good experience, or feeling more engaged and more purposeful. Advocacy is an incredible way to do that, not just for yourself, but for your whole community. So I wanted to put these bugs in your ear. So today, if you do nothing else today, after you hear from me during a break, go to hdsa.org/take action. Send a message today. You know, do something today. It's how we can make big changes for us and for our community. So I know I'm a little bit over time, so I'll wrap up. Thank you guys so much for letting me come in and talk to you guys about advocacy, something I feel so passionate about. And my job as well is to make this easier for you guys. So if you have questions, if you think, yeah, you know, I'd love to take a meeting with my representative, I'm not quite sure how, what do I do? How do I set this meeting up? Reach out to me, you know, jsimpson@hdsa.org. I will help. You know, I can help facilitate this. I can help you prep for the meeting to say, okay, here's what you can talk about. Here's what you need to know. You know, you don't have to be a political science major to do this. You don't have to be a, you know, wonky DC insider to be effective here. You know, the job of our community is to educate our members of Congress about what it's like to have HD in your life. That's the thing you need to be an expert at. You know, me and the other folks at HDSA can help with all the other wonky stuff. You just have to be an expert in your own experiences. So with that, I will wrap myself up. Thank you guys so much for having me. Thank you for giving me the opportunity. And thank you, Lisa, for organizing all of this.
Jennifer, thank you so very much for everything that you do. And I think the most powerful things for me was we're all advocates in everything that we do. Thanks for being our constant at HDSA. And everyone, I know it's not in the schedule, but we're going to take a 10-minute break so everyone can just move about. Grab a cup of coffee, grab a cup of tea, whatever you're into, and we'll be back in 10 minutes if that's okay. Yeah.
Guys, the restroom, I'm so sorry. Go out. They're on your right hand side. There's coffee, there's orange juice, and all sorts of good stuff. Yeah. You ever meet the you know my dog. Can you breathe now? I understand. Do you have I've never done it.
I don't know how to work it. There's this one that you can try, but I'm gonna actually click for her. So if you want to try, there's the right click on the mouse. And then you go there. Just go through. If it doesn't, then just say next. And I'll go to your next slide.
No, all the.
I just don't think it's gonna work. This is the church's equipment. I'm not from Huntington. And we're on the back side of it. Yeah, just go try that up there and see if it goes.
Okay. I don't have to get mad about not having a boy around. That's my own charge. We'll see. We're all in.
Yeah, that's what mine was too. I mean, I actually might like but at the same time. Oh, really?
Oh, yeah. I made a name taker, and I like it a lot better because people can pronounce it. Okay. Yeah.
Oh. Yeah.
Not like that.
He's fine.
Yeah.
Well,
We should be like,
So that's my oldest, youngest is like middle one. Yeah. We live like really close by, so I try to bring them. But usually there's a couple of extra kids. I guess I'm just easing back into things from COVID. So it's a smaller than. It's your first time coming. It's usually about like twice.
okay.
And there's probably 5 or 6 kids running around. So. Yeah, 13, 14. They're like about a year and a half. A little more than a year. Oh, yeah, she worked at the next time.
you work with kids?
Do you remember the person that was stressed? You got the or anxiety? That really knows her. I forget her name.
Okay.
It was when she like screamed for like I told you about it before. She used to be part of Huntington, like forever now. She does anxiety. I forget what she looks like. I forget her name. She's really sweet though. You said it, I might recognize it. What's the last name? She's still a Vanderbilt person.
Yeah.
Whatever. She's got, no, she has her PhD. She's like her own PI. I think she was like around the same time as you two. Like whatever year you guys, like maybe plus or minus a year or two. Like you guys are students together or whatever. I was like, do you know first conference? I was like, yeah. I worked with him. And then I just brought it up to you guys. I think I brought it up to Abby. And Abby was like, she's not a YouTuber. Yeah, Dr. Bennett. Remember that?
Yeah,
Click on the.
It was like a year ago.
because that's what I'll do with hers too.
There's one slide.
And I can see.
This it's just a trait. You might have to hover over it.
Guess you'll get your photos. I was like, why should we? I'm like,
This is mine, and I can do more on this one, but this is the one that's picked up. So what I need to do is click through. I'm gonna exit this shell and make sure I have yours. And hers. Yours is this way, right? He runs Flourishing.
Yes.
Yeah, they come to you.
That's better for me, because there's a lot of times it's certain people are telling you this.
If you hover it
I don't like catching this part.
Okay, yeah, okay. All right. No, that's fine. We will get it done. Hey, oh,
The only reason I was thinking about it is whatever.
this is me multitasking.
Okay.
And I'm on Zoom. No, I'm always I'm right behind you, so
Okay.
also calling you, but I have the best job in working education in high school. My oldest went to be in the I'll have families at the office too. But anyway, teaching training in Los Angeles.
What are you teaching?
Yeah. Pandemic. So, but I'm teaching consultants to teach. And I'm a traditionalist. Through my years, for lack of a better term, it's my space. And that's very frustrating to those of us. And my issue is the choice of mine is just to help one differently. So I was pretty. I want to make sure they're living in me, and I want to make sure. So when they transition to college, other than the fact that, look, you're paying for it. So and they say this is this, and you're mind, you can do this education, it's their job to give you the ability to solve a problem. And then trying to make your education working back. Okay. Doing really well. Like I did. Yeah. Two of them. And now yes. I do it myself. Two of them were Sundays are looking at your time. Well, I can. Yeah. Okay, yeah, that's what I was thinking. Yes, and do it. Yeah. Okay. Yeah. But everything else is on the phone. Oh, that's so.
Hey, everyone, thank you so much for your patience. We will begin in about 5 minutes.
We can put you in somewhere.
We could let you do it.
There's some nice couches in
It would be
there.
easier for you. You don't have to plan.
Oh, no, it's okay. Okay. It's okay, I don't mind doing that. Yeah, well, I've got her sleeping, so it's fine.
No, I don't.
You've never. No, right trigger.
Hey, everyone, thank you so much for the impromptu break. We apologize, it's not in the schedule, but we definitely needed it here face-to-face in Nashville. Guys, I have the honor of introducing somebody really incredible. I met her 3 years ago. Her name is Dr. Kelly Watson. She's part of the Stress and Coping Lab run by Dr. Bruce Compass. She is an anchor, this incredible human being, and she's going to talk to you about a youth study, our family study, and some of the new things that we're going to be doing in the new year. Everyone, I'm very proud to introduce Dr. Kelly Watson.
Thank you for that very kind introduction and stuff. So what I want to do is tell you about the project that we're doing with families, with a special focus on involving children, teens, and young adults. Lisa kind of already gave the introduction, but I just want to tell you a little bit about myself. So I'm a licensed clinical psychologist, and I work as a research associate in the Department of Psychology and Human Development at Vanderbilt. My research training has broadly been in trying to understand how families cope with and communicate about difficult, stressful things in their lives. So I was really fortunate at the opportunity a couple of years ago to get involved in this ongoing project, Families Coping with HD. This project started out of collaboration between Dr. Allison and neurology and Dr. Bruce Compass in the Department of Psychology at Vanderbilt. So what I want to do is tell you about the project we're doing, let you know a few things that we're beginning to learn and what's next, where we go from here. We can switch to that. So our study is called Families Coping with HD. You may have heard it referred to as the youth study as well, but we really want to emphasize that this is about families. When we started the project 3 years ago, there wasn't a lot known about how families try to cope with the stress, what is stressful for families about HD, and how do families talk about it. So since that time, we have had 75 families at Vanderbilt participate, and over 110 children, teens, and young adults between the ages of 7 and 39. And we are still inviting families to participate, where there is a child, teen, young adult in that age range who can participate with a family member. And what we are trying to do is use the best methods that we have through behavioral science and the field of psychology to understand sources of risk and sources of resilience for families. So what exactly is it about HD and the experience that's stressful for families? How do families try to cope with the stress, both in ways that are helpful and in ways that are maybe not as helpful? And how do families talk about their experiences? And what might make it easier or what might get in the way? So what we do is we ask families to complete some surveys online about stress, coping, emotions, behaviors, and then we ask families to come to Vanderbilt to do some tasks. I won't touch on everything that we ask families to do, but we ask parents and children to do some thinking tasks on an iPad that are relatively brief and straightforward. And then we also ask families to have a couple of conversations together in private, but while being video recorded. We ask families to talk about some of their most enjoyable, pleasant memories that they've shared together. And we also ask families to talk about some of the challenges and difficulties that they face because of HD. And our study is longitudinal, meaning that we ask families to come back 1 and 2 years later to do similar tasks. And that's because we want to understand how things may change and how things may stay the same. And we are, like I mentioned, continuing to invite families to participate because we want to learn from as many families as we can. We know that there are absolutely shared experiences, but also no two families are the same. And one of the reasons we want to learn from so many families is we feel fortunate to have funding support from CHDI to take what we learn from families and give back to the community by developing educational resources and materials for families to build resilience, strengthen relationships, and to improve well-being. What exactly those materials will be, we are at the early stages of creating them, but I want to share with you a few things that we're beginning to learn from the work we've done with families that we know will inform those materials. I want to tell you something about stress, coping, and communication. So first, stress. Undoubtedly, HD is a chronic stressor for families that endures over time across generations. But we wanted to understand what exactly is it that's stressful for families. So with the help of professional experts, we generated a list of things that families might find stressful, and then gave the list to families and asked them to mark what have they found stressful recently. So I want to share with you what we're so probably not surprising, there are many types of the experience that's stressful for families. And probably also not surprisingly, what's stressful is not necessarily the same for patients, spouses, caregivers, and children. So I want to share with you some details about what families have told us with a couple of caveats. So the first is that these lists are not exhaustive. There are things that will not show up on these lists that families absolutely experience as stressful. And the list will continue to grow as we learn from families. The second is the second thing is that not everyone will experience everything on these lists as stressful. So I want to start with patients. So here's just a bar graph, and underneath each bar is the stressor. And then above it is the percentage of patients in our project that said, yes, I experienced that as a source of stress. So you can see for patients, the overwhelming majority of patients say the effects that HD has on my family is stressful. You can see the majority of patients say uncertainty about the future and financial concern. 42% say the progressive loss of independence. And 1 in 3 patients say feeling isolated from others and just growing up with HD as a part of my life and part of my family is stressful. If we move to spouses and caregivers, you can see that there are similarities, but there are also differences. So the overwhelming majority of spouses and caregivers say increases in responsibilities is stressful. Similar to patients, financial stress and concerns about their child's risk is a source of stress. And then nearly half of caregivers and spouses say feeling isolated from others. And then 1 in 3 say chaotic home environment and unpredictable home environment and burnout. And if we go to the children, this is adolescents and young adults combined. So this is 10 to 49-year-olds. This is a broad age range, but you can see that nearly half of the youth in our studies say uncertainty about the future is stressful, and also increases in responsibilities. 1 in 3 youth say judgments from others about my family, life feeling out of control or unpredictable, and again, feeling socially isolated shows up. Fewer youth say that HD interferes with school and work, but we do see that that is true for some youth. So the takeaway message about stress is that there are many parts of HD that families find stressful, but what is stressful may not be the same for everyone in the family. And one of the reasons we care so much about stress in our work is that we know that it's related to how people are doing, to their mental and their physical well-being. And we also know that there are strategies and tools in psychology that can help reduce the effects of stress, even just a little bit. And one of those strategies is coping. So I want to tell you about what we're beginning to learn about coping for families. We can switch. So coping is how we deal with the stress and the difficult emotions that we experience in life. And there are many ways that people can cope with stress. And we know from decades of research outside of HD that there are some strategies that tend to be more helpful than others. The basic rule of good coping is control what you can and accept what you can't control. But we didn't want to come into this work assuming that that was the case for families affected by HD. So we gave families a list of strategies that they could use to cope with stress and asked them to tell us how do you cope with the stresses that come up. And one thing we're beginning to see is that families cope in different ways. Not everyone copes with the stresses in the same way. But we're also seeing that that basic rule holds. That family members who tell us, I try to control what I can, and I do things like problem solving, thinking about what Jennifer Simpson presented on advocacy could probably fit in there, seeking support and getting help from others, and people who say, I accept what I can't control. For things like acceptance and distraction, they tend to experience less depression and less anxiety. And that's different from family members who say, try to avoid it. I try to wish it wasn't happening. I try to deny that it's happening. Those strategies don't tend to be as helpful. I think an important thing to point out is that when people cope with HD or cope with anything, most people use some of all of those strategies at some point, depending on what's going on, depending on how they're feeling, just depending on the day. What I mean is that when people use more of the strategies more often to control what they can and accept what they can't, that tends to be better for well-being. So the takeaway message is that how family members cope with stress is important for well-being. I think this is good news because we know from decades of research We can teach people how to cope with stress in ways that can be helpful. And then the last thing I want to just highlight is the communication piece. So we wanted to understand if families talk about their experiences, how do family members talk about it, and what are things that might make it easier or get in the way of having those conversations. So like I mentioned earlier, we asked families to talk about it. We asked family members to have a conversation about what are the challenges or difficulties you face. What are the emotions you've experienced? And how do you try to cope with it? We asked family members to talk about it for 10 minutes. It's pretty open-ended. They can talk about what they want, but we asked them to talk about HD. And so you see that many families do talk about their experiences, but a lot of families have expressed less difficulties having those conversations, being unsure of what to say, feeling uncomfortable, or just worries about how those conversations will affect their family. We also see that warm and supportive communication in those conversations between family members is related to better well-being. What I mean by warmth and support is independent listening, expressing care and concern for each other, showing empathy. That tends to be related to better well-being. And one thing that might make it easier to show warmth and support is how families cope with their experience. Going back to what I just talked about with coping. We see that when families say they try to control what they can and accept what they can't, they also tend to show more warmth and support in conversations. When people avoid it and deny it and wish it away, they don't talk as much about it, they're more disengaged in those conversations. So the takeaway message here that we're beginning to learn is that family members do talk about their experiences. While some do express difficulties, ways that families cope with the experience might make it easier to have those conversations. Good coping is like it facilitates good communication. So what's next? Where do we go from here? Like I mentioned, we're fortunate to have the funding, support, and faith from HDI to take what we're beginning to learn from families and what our team has learned from other families to develop materials and resources that can be helpful to improve well-being, strengthen relationships. And we know that we will want those materials to at least focus on what's stressful about this experience, helping family members learn coping strategies that can be helpful, and supporting families in the strategies they're already using that are working for them and are helpful, and helping families talk together about their experiences to strengthen relationships. That's where we know that we want to go. We are going. And then we are awaiting final notice of funding support for 5 more years to work with families from the National Institutes of Health to continue learning from families and all the things I shared with you today. But also we want to learn more about social relationships and connections. Like Dr. Watson said at the beginning, these last 18 months have been so isolating for so many people. And if you think back to those stressors that I showed you about, families have said, so many family members say that this experience can be isolating. And we want to understand what is it about the experience that connects people, that makes people feel closer, but also what are the parts that disconnects people and makes people feel isolated from others. We know that social relationships and connections are so important for health and well-being. We want to continue to learn, always with the goal in mind of how can we give back to the community and help families build resilience and reduce vulnerability. So that's what I wanted to share with you today, kind of what we are beginning to learn from families. So grateful for all the families who have participated in our work. And I just want to acknowledge all the many members of this team that have made this work possible, and truly there are people not on this list that are so important to what we're doing. And then the last slide just has my contact information. If you have any questions about anything I shared with you today, or want to hear more about the work that we are doing, absolutely feel free to email me. The email's there.
Thank you, Kelly, for talking about in a very succinct and beautiful way the efforts of two incredible labs collaborating for families. Everyone, as we talked, Dr. Clausen talked about earlier, the past 18 months have been challenging, stressful, etc. But the purpose of today is to kind of turn that boat, turn that direction, and really try to understand how as a team, how as a community, and how as people, we can learn to flourish.
Okay. He's fine. I'll call you back
And
in a
there's
minute.
no one any better to help us with that but Dr. Bill Pearson. Everyone, he's our keynote speaker. We're very, very excited to have him, Dr. Pearson.
Well, thank you. It's really great to be with you all today. Thank you for the very generous invitation to be here. What I'd like to do is take about 20 minutes and share some thoughts about human flourishing, and then we're going to take some time to have conversations around the table. And you guys are going to help each other, and then we'll come back together and hear from everyone. So I am an anatomy professor by trade. I've had the pleasure of teaching, being around first-year medical students for over 30 years. That's my population. And so you might wonder, what's an anatomy professor here talking with folks about Huntington's disease and flourishing? Ironically, I actually give the lecture on the basal ganglia, and I have a slide on Huntington's disease, which means I know absolutely nothing about Huntington's disease. I really have no idea what it means to live with it, what it means to care for people with Huntington's disease. And so you guys are the experts on that. I'm here as an expert on med students. That's what I do. And I'm going to talk to you about my work in flourishing with that population, and then see if we can flip that to think about how we think about human flourishing in this population. And I'm going to need a lot of help from you guys, especially Eugenia, who's running my slides back there. So she's my human clicker. So every time we do this, we're going to advance it. So thank you for that. So it's a really interesting population of people. They're really amazing human beings that come into medical school. People have very humanistic qualities. They want to serve others, very bright, they love science. And they come into our place of learning, and then they leave, and they're definitely competent, but also very in debt, often neurotic. And we have this amazing group of well-adjusted people who somehow, many of them need to get on antidepressants when they're in school. So what's going on? What are we doing to these wonderful people? And this is a conversation I like to have with students. What is the difference between winning and flourishing? They're all used to being on the top of their class. They get into medical school because they score 2 standard deviations above the mean on exams, and then by definition, half of them are below the mean. Many of them, in fact, we just gave our first anatomy exam, and 40% of the class failed, which usually happens. And so for the first time in their lives, these students are failing at something. And their sense of well-being and identity and everything is really refreshed. And so I like to talk with them about what's the difference between winning and flourishing. How many students can win at med school? How many can stay 2 standard deviations above the mean to be the top of their class, if that's what it means to do well as a student? But how many can flourish? And I think that's an important question. So, Gina, can you advance this? So this is the intended effect of what we do. We bring these people into this greenhouse environment, and our intention is to equip them with medical knowledge so they know a lot of stuff. They know how to apply that to their patients and patient care. They should be experts in communication and understanding where people are coming from and being able to communicate with them and their care team and others. Of course, we hope that they're ethical, that they understand the healthcare system that they're working in, and that they're also working on self-improvement and can do practice-based learning. So that's the intention. And Eugenia, if you just hit it a couple of times, this is the flourishing position. That's what we hope for. But in reality, what happens is this. If you click it to the next slide, our students really focus on medical knowledge. They become professional test takers. And if you click it forward another time or two, so what happens is, instead of flourishing as a future healer of persons, they become distorted into something else that they didn't really sign up for. And not only do they maybe they're able to master a body of information, but by the time that they finish their training, they realize that market forces are really controlling a lot of decisions. There's a lot of bureaucracy that's involved. And everything that they wrote about in their personal statement about why they wanted to be a physician often gets lost. And I think this is where you have a lot of physician burnout. You might have heard this term, moral injury, this, that, and the other. So this is the dynamic that we're working with, and how do we deal with that? So I wanted to share with you a little study I did. Eugene, you can go to the next one. This was a learning community that the dean allowed me to put together at the Medical College of Georgia. I recruited 12 first-year med students, and we had a cohort that was representative of the broader class. And we worked together to try to recapture this idea of flourishing. Look at these different domains of flourishing. What's the meaning and purpose of our being here? How do we grow close personal relationships in a hyper-competitive environment? These kinds of things. And this data right here on the x-axis is burnout. So the further to the right you are, the more burned out you are. And the further on the y-axis is wellness, quality of life. So the further down you are, the less well you are. And this is where they started at the beginning of the semester. And if you click the video for us, Eugenia, this is what happened after one semester. Burnout went way down, wellness went way up. So what happened in those 3.5 months that changed these outcomes, not only compared to their classmates at the Medical College of Georgia, but across all medical students all over the country? If you go to the next slide, this is a very complicated looking slide, but basically what this is called the principal components analysis. What it's showing us is that those who understood what their mission was and had a high sense of community and adopted sort of a growth mindset, that was protective or preventative of disengagement. And disengagement is defined as the extinction of motivation and incentive, especially when one's devotion to a cause or relationship fails. So I heard Dr. Watson talking about the stresses of Huntington's disease. And of course, being in graduate school, professional schools, is a different kind of stress, of course, altogether. But what can happen is we can become disengaged from ourselves, from others. And how can we pursue a way of flourishing that will keep us from being disengaged and being engaged with each other? And for this group of young men and women, remembering why they're here, what they do, connecting with each other, understanding, helping each other through each other's struggles and failures was really helpful for them. So Eugenia, what do we have next? That's our next slide. So here's the question for us, and here's what I'd like for us to pivot for this community today, is what is the difference between health and flourishing? And a lot of times when you think of yourself as a patient, you're thinking about, am I healthy, am I not healthy? If you're a caregiver, the focus is on health. And might there be something to be gained from pivoting from thinking about health to flourishing? How many people living with Huntington's disease can be healthy versus how many of them can flourish? So if we go to the next slide, we get the WHO definition of what it means to be healthy. They define it as a state of complete physical, mental, and social well-being. And by that definition, whether you have Huntington's disease or not, you're probably not very healthy. I mean, nobody in here is running a marathon, nobody, so we're all in trouble as far as that, especially if you have Huntington's disease. If you focus on health, this is a very dismal outlook for what's ahead. Whereas human flourishing is a lot more robust than that. So human flourishing index was put together by a guy named Tyler Vanderwill, who I happened to get to know when he was a graduate student at Harvard. He was working on the second PhD. His other one was from Oxford. He's one of the brightest, most humble people that you'll ever meet. His science is in understanding statistical causality. He's written a textbook on that. And he came up with this idea of measuring human flourishing as an epidemiologist. how do we understand what our efforts are in health and their outcomes? And so this is taken from this publication of Proceedings of the National Academy of Sciences, where he looked at the literature, not just the medical literature, but the sociological literature, the philosophical literature, I mean, all the literature. And then to think about what are the domains of human flourishing, and how do humans pursue those things? And what he found is that the things that we measure, the things that are published, things that are reported, are not only kind of your typical happiness and life satisfaction, which psychologists get us into, or physical and mental health, which physicians get us into, but also domains like meaning and purpose, and close social relationships, and character and virtue is a means of human flourishing. We might ask ourselves the question, if someone is a very healthy individual and is running a multinational corporation that's exploiting the poor all over the world, are they really flourishing as a human being? And so our character and virtue is a part of our flourishing. And there are many ways that people pursue these through our families, through what we do for a living and our occupation. People get an education for these reasons. And then faith communities are a big part of these domains as well. All right, next slide. So I've wondered if maybe the unintended effect of focusing on health is something of what our students have experienced. So if we click that forward, if our focus is there are some that are, if the clinical trials go really well, or some great discovery is made and health can flourish, but for the rest of us, we're kind of down in the shadows. But what if we could advance that to expand the definition of what we're looking for? And these are these 5 domains of human flourishing. And if you click once more, Tyler and his team added financial and material stability, because that's important in order to maintain our flourishing. So that was the 6th domain that was added. And if you click it ahead a couple, if we can refocus, then might we be able to flourish, even if our physical and mental health may not flourish? Are there other ways that we can flourish as humans? And interestingly, I haven't read if Tyler's published this or not, but I heard him give a talk recently about suffering index. And I think it's intuitive to think that maybe the more you suffer, that maybe you wouldn't flourish as much as a human. But actually, in their research, what they have found is that those who suffer often flourish more than those who don't. Because when we suffer, we have to dig deep. When we suffer, we have to rely on other people, and we flourish as humans best when we are living in community and we're caring for one another. We have to take stock of who we are as a human being and think about character and virtue and some of those things. And so it was an interesting finding that those who suffer may actually flourish more as humans. So what's our next slide look like? So this is the Secure Flourishing Index that he put together. And I just was going to read through these so you can kind of understand each of these domains. So happiness and life satisfaction is just measured as how satisfied are you with life as a whole these days? Either not or completely satisfied. In general, how happy or unhappy do you usually feel? Mental and physical health is just measured by, in general, how do you rate your physical health, or how do you rate your mental health? Meaning and purpose, the question is just asked, overall, to what extent do you feel the things you do in your life are worthwhile? Or do I understand my purpose in life? Another, the character and virtue domains. I always act to promote good in all circumstances, even in difficult and challenging situations. You can make the argument that if you're living with Huntington's disease, you have the opportunity to be in a very challenging and difficult situation. I'm not always able to give up. I'm always able to give up some happiness now for greater happiness later. Close social relationships. I'm content with my friendships and relationships. My relationships are as satisfying as I would want them to be. And then finally, for financial and material stability, which Allison and Jennifer both were talking to you about earlier, which is really important. How often do you worry about being able to meet normal monthly living expenses? And how often do you worry about safety, food, or housing? So these are the different measurements. I just wanted to go through them and sort of explore each of those different domains and have you think about them, because if we go to the next slide, what I'd like to do in these breakout groups for the next 30 minutes or so, you can click it forward, is to consider these two questions. And the first is how can care be refocused on flourishing? So as either caregivers or patients or family members, that's what I meant when I said caregivers, the healthcare team, together, how could we refocus on flourishing? What would that look like for us to think about focus on that? And then a second question would be, just for yourself or for your family, what 2 to 4 things can be done in the next 90 days that would promote an overlooked domain of flourishing in your life? And I might, especially as a medical educator, encourage the clinicians in the room to think about this, as well as our families. So maybe think about the low-hanging fruit. Is there something that's been completely neglected? Maybe your financial affairs is just something ignored and you really haven't wanted to deal with. Is that some low-hanging fruit? Or maybe there's some relationships that need to be mended in your family. Maybe some reconciliation that needs to be pursued, or whatever that domain might be. And so it might be interesting to think about just 2 to 4 things that you could pursue to pursue one of those domains. Is that clear? Any questions about the questions, so we know what we're doing around the tables? Well, that seemed pretty straightforward. All right, I'll just appoint somebody self-appoint themselves to be a facilitator at each table.